Hey guys, my name is Caitlin, and I decided to do my research project over knee rehab. I work in a physical therapy clinic, so we see a lot of patients coming in with knee rehab, and so I thought I'd look a little more into it. So you see a lot of injuries that deal with the knee. One of the most common ones that people are most familiar with are the ACL tear, and then you'll also have the meniscectomy, which is the removal of the meniscus. You'll see patellar quad tendon repair, and a lot of times you'll see total knee replacements in the older population, as well as a lot of osteoarthritis. You'll look at the weight-bearing statuses of the patients when they come in. You have all the way from non-weight-bearing to full weight-bearing. Toe-touch weight-bearing, that's just simply being able to put your toes on the ground. Partial weight-bearing, you're slowly starting to do, put just a little bit of weight on it. And then weight-bearing is taller, that's kind of a little more up to the patient and what they can tolerate on a personal level, and you see that with using canes and walkers. You'll also look at gait deviations, which is how they walk. One of them, and one of the most common ones, is antalgic, which simply is limping. You'll see that a lot. You'll have decreased stance, which is taking smaller steps instead of their normal step. You'll see lateral swaying, which means that they're kind of moving their whole body to make themselves walk instead of just using their legs. And then you'll have a decreased heel strike and toe off, which means most of the time when you're walking, you're told heel toe, and a lot of times patients will kind of look like they're stomping their feet instead. A lot of the exercises you'll do will be referred to as open versus closed chain. An open chain is when the distal part of the body is free and not fixed, whereas a closed chain is the distal segment is completely stationary in regards to the body as a whole. So example of an open chain is for ACL rehab. You can't have open knee extension because that's going to put a lot of stress on the repair that they just did. Whereas for a total knee, a closed chain exercise you can do is short arc and long arc quad extensions, which is literally just straightening that leg and getting it to full extension. You use a lot of modalities in physical therapy. One of the most common for patients who have just recently had an injury or surgery is a hot pack, because it passively warms up the tissue instead of actively, like riding a bike. And then after the treatment, you'll often put them on ice compression, which helps to reduce swelling and inflammation. You'll also use ultrasound pretty often. Depending on how it's set up, it's either going to produce healing effects or it's simply going to heat up that deep tissue. You have some main goals of rehabilitation as a whole when you're looking at knee rehab. One of the biggest ones is you're going to want full knee extension and flexion of that knee. You want that patient to become completely weight-bearing. You also want them to have balance and good gait, so they're walking well. You want to make sure that they're not a fall risk. You want to make sure their quad and hamstring strength is back to where it should be, because you're going to lose a lot of that in the recovery time right after surgery. You're going to want up to 120 degrees of knee motion. I've been told that is what is considered to comfortably get on and off of the toilet. And you also want to look at minimal to no swelling. Aside from your overall goals in terms of knee rehab, you also need to look at patient-specific goals, which means that you could have someone of the older population that simply wants to be able to walk between rooms without pain in their own home, or you could have someone of the younger population that wants to get back to competitive sports, or being able to run and walk and jump around, just whatever they want to get back to. You need to make sure that you do everything in your power to get them there, and that means adjusting the rehab program to each individual patient.